Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Hi, everyone, and welcome back to the Cabral Concept. It's great to have you here with me today. I'm excited to get into our Total Wellness Tuesday show, where we are building off of our Ayurvedic knowledge. We talked about facial diagnosis a little bit previously. We've talked about tongue diagnosis in depth, and we even went over nail diagnosis. So what we're going to do today is talk about the lips and what your lips say about your overall health. This is extremely important because as a practitioner, if I look at someone, I can instantly tell so much about their internal health by looking at their skin, and namely the lips as well. So what I'd like to do on today's show is actually discuss with you where Ayurveda says your health may be going wrong or starting to go downhill based on your lips and what they look like. And then I'm going to talk about it from an also functional medicine perspective, because one of my favorite things to do is to be able to combine the best of Ayurvedic-based wisdom, traditional Chinese medicine wisdom, and combine that with state-of-the-art functional medicine. So, because there's so many people out there that are skeptical about the old forms of medicine, but you have to understand is they had thousands of years to perfect this, right? Thousands of years, but yet in conventional medicine or even like functional forms of it, only 100 or so. So again, I love combining both. I think there's so much wisdom and we can help so many more people if we begin to understand that there's not one best form of doing things. There's not one best form of medicine. Being an integrative health practitioner means that you're combining all the best forms of medicine and you are allowing the person to heal how their body is best able to heal. And that's taking the best from everything. So what I want to do right now is share with you what may be happening to the lips from an Ayurvedic perspective, showing you that something very specific and very wrong is going on inside of the body. So Ayurveda looks at the top of the lip and the bottom lip a little bit differently. The top of the lip is actually signified right in the middle with the heart. Okay, that's really important to understand that and look at that. As we move from the middle of the lip to the sides, we're looking at what would correlate with the lungs. Okay, now on the right side, we're looking at the liver. So the liver and lungs are right to the right of center. And then to the left side, we're actually looking at the spleen and more like the pancreas. Why does that matter? Well, what we're looking at specifically is where it aligns up with the certain meridians of the body. And what that means is that it's not from like TCM acupuncture-based meridians, but actually what's in line with the body. Like oftentimes pain behind the right eye can signal a liver-based issue. And that's important to look at that. We also know, and I've talked about this before on the house calls, that an enlarged spleen or a swollen spleen, that pain can actually radiate to the kidneys or it can radiate all the way up to your left shoulder blade. Well, you might be thinking you're having a heart attack, or you might think that you pulled a muscle when really, in actuality, you have an enlarged spleen pressing on the nerve that is actually connected with the upper shoulder and left shoulder. So important to look at these things. That's very, very crucial. Now, I'll talk about why they correlate in just a moment. The bottom lip, though, correlates more with the digestive tract. So really we're talking about the intestines and namely more of the large intestine and colon in the middle of the bottom lip. To the sides is more of the small intestine, and then when we work out to the outer edges, we're talking about the kidneys and adrenals. Now, specifically in Ayurveda, it means this. Usually we see lip discoloration or a spot on the lips, often correlating to an issue with that part of the body. Now, sometimes we do, sometimes we don't. I actually did a show on iridology before. So if you want to check out iridology, another form of looking at the eyes as a diagnosis. Now, I'm not talking about a conventional medicine diagnosis. I'm talking about looking at maybe some of the underlying root cause issues and areas of why the iris, which is the colored part of the eye, the pupil being the black part in the middle, would actually be wrong. Why would there be a black spot there? Why would there be a white spot there? Why would there be some haziness there or even discoloration in that part of the eye? I'm telling you, it's not every time, but you'd be surprised as a practitioner, someone like myself who studied iridology, able to look at someone's eye just as part of the overall assessment protocol and actually see a correlation with thyroid, actually see a correlation with the hormones of the body, the digestive tract. It's pretty unbelievable. So again, it's just one opportunity for us to get to explore this. All right, so I talked a little bit about Ayurveda. Now let's talk about from a functional medicine perspective. And I want to go over 7 main ways that your lips are telling you what is going wrong with the inside of the body. So first things first, I want to share with you this. There are 2 main things that can be affecting the lips, like the dryness, the cracking of the lips. Let's talk about those. The first 2 main ones, in many of the cases, let's say half, are dehydration. So first things first, like let's just get this out of the way. Are you drinking about half your body weight in ounces of water per day? I always go with 160 pounds because I like simple math. So if you weigh 160 pounds and you need to drink half of your body weight, which is body weight in pounds, and then you need to drink half of your body weight in ounces per day, well, that's 80 ounces. And if we divide 8 ounces per cup, we're looking at 10 cups of water per day, which is approximately equal to 5 bottles of water, 5 16-ounce water bottles. So just to make it a little easier for you, that's what it is. Now, you can get this in many different ways. It counts as a smoothie. It counts for herbal tea, and it counts just for fresh, straight water. If you want to find the best types of water, you want to find the best water filters, you can just go to StephenCabral.com/podcast. Many, many shows on those as well. Okay. So what I want to talk about, though, is what if you're not absorbing it, right, for dehydration? That is why it's often nice to drink the smoothie because you're going to get a lot of minerals and vitamins. That's going to help with the absorption. But if you're just drinking straight water and it kind of makes you bloated sometimes or just kind of washes through you and you just have to urinate right away, well, you might want to add a pinch of Himalayan sea salt and a squeeze or a whole lime or half a lime squeezed in that water. Lemon works as well. And the reason why this works is that you get the sodium, the salt, which is an electrolyte that your body needs for absorption, from the sea salt. And then you get the potassium from the lime or the lemon. It's an easy way to make your own natural Gatorade, as I like to say, and can be really great for absorption. Now, some people, believe it or not, with really low blood sugar levels, they're not going to absorb the water either. They need to actually mix in a little bit of raw honey into that water or a little bit of maple syrup. Now, again, that's not for everyone, so don't take that unless you know that you're someone that's more on the adrenal exhaustion and HPA axis dysfunction and hypoglycemic, okay? But for those people, believe it or not, you have to be able to absorb the water. And your body's not going to absorb more water if it would further dilute your blood, which would further dilute your blood sugar level. So this goes pretty deep, right? I don't want to get too deep on this today, but just think electrolytes first. And again, smoothies takes care of this with most people. So again, great way to do it in the morning. That 32-ounce smoothie, add your 2 scoops of your daily nutritional support powder, add 1 cup of berries or maybe 2 cups, depending on what you need for your energy in your body. Add some greens if you want, add some healthy fat, blend it up, drink it over the course of an hour. I mean, not too much better than that in the world, right? Not too much healthier for sure. Okay, so next up, I want to share with you this. If it's not dehydration, could it be a medication you're on? Here's the deal. Blood pressure medications, diuretics, sometimes blood thinners, allergy medications, inhalers, antihistamines, all of those things and many more could cause dehydration. So if you're on a medication, I can't list them all today, try to think to yourself, after taking this medication, a couple weeks later, did my lips start to get dehydrated, dry, cracked, discolored? Because it could be the medication-based issue. If that's the case, well, I always ask, do you need to be on that medication? And I'm telling you, for the most part, you can figure out the answer as to why you're on that medication. What are your underlying root cause imbalances that if you were to figure those out, you'd be able to correct them. And if you corrected them, well, that dis-ease that you're taking the medication for could no longer live in your body. So I'm not telling you to stop the medication. You have to work with your medical doctor on that. But what if you could correct the underlying root cause imbalances and actually fix that? Well, then the medication would become unnecessary. And I don't want you to use genetics as an excuse. Check out my previous podcast on that, okay? So first things first, check dehydration, check medication. Now, the next thing I want you to look at is an actual yeast or fungal-based infection. Could it be a yeast or a fungal-based infection? Because so often, the dry, cracked lips, whether it's the whole lip, all over the lips, a little bit in the corner, it can cause it can be caused by a fungal-based infection. Now, there's 2 ways to get this. Locally on the lips, locally in the mouth itself, okay? It can start with thrush and actually work to your lips as well, or simply be localized on your lips. And that's because warm, moist exposure could cause yeast-based infections. Now, that's only going to happen if you don't have a good, nice balance of bacteria inside that mouth, okay? So super important, but it can happen, okay? So that can happen. But the second reason is that you can actually have a fungal yeast candida-based issue with the gut. And because of that, it is showing itself on the outside as well. Now remember, these lips right here, they are the first part to your digestive system. Your lips are the first part to the digestive system. They actually work with digestion. They help with the chewing-based process, keeping your mouth tightly closed, chewing up that food, being able to produce enzymes inside the mouth. So we have to understand is that our mouth, and that includes the lips, is the first part of our 28-foot, give or take a little bit, digestive-based system. And because of that, I want you to realize that your mouth does matter. The esophagus, the stomach, yes, the 21 to 23 feet of small intestine, and the 5 to 6 feet of colon or large intestine. All of it matters, but let's look towards the mouth. How do you know if you have a yeast infection or fungal-based infection? At least gut-wise, you can run the Candida vitamins and metabolic and vitamins-based test, also called the organic acids test. It's a great one to look at to assess that. You get 9 markers to look to see if there's potential waste markers from the yeast and fungus. Okay, important to look at that. A second one that I want to share with you today, and this is one that's also overlooked, and that is vitamin deficiency. Now, I want to tell you where this one shows up a little bit more. The corners of the mouth and fine lines above the lips, okay? Corners cracked, fine lines above the lips. Mineral and vitamin-based deficiency. Which one specifically? Well, the ones that break down when your body's becoming more catabolic. So namely your B vitamins. Why are B vitamins so important? Why do I keep talking about them? Here's why. They are your anti-stress and energy vitamins. Bottom line, that is the family they are a part of. So if you are low on those, and trust me, stress depletes them. So does low stomach acid. So does poor digestion. And so does an imbalanced gut microbiome where we can't actually make that B12 in the gut and other B vitamins as well. So it's a sign that you might be low on your B vitamins. Also a sign that you're low on the minerals and vitamins that repair tissue. It could be vitamin C. It could be zinc. It could even be lower amounts of protein or copper. So I want us to keep things simple. Honestly, I always keep things simple. A good daily activated multivitamin, a functional medicine-based formula with the methylated B vitamins, or the daily nutritional support with the alkalizing vitamin C, or the full spectrum vitamin C, and the balanced zinc, just 1 capsule literally with dinner. For the alkalizing vitamin C, 1 scoop upon waking, or 1 capsule of full spectrum vitamin C at breakfast and 1 at dinner. Like super, super simple. But inside of that daily activated multi and inside of that daily nutritional support, you're going to get all the vitamins and minerals that your body needs. So it's easy. And then if you wanted to, on top of that, add on the advanced collagen support. So those are just a couple of the vitamins that you might be deficient in, but those are also the most common. Now, as a side step to that, one of the vitamins that can be toxic in your body, and I see it happen more in women than I do men, because a lot of the skin-based products that women may use, but also men, contains retinol and higher doses of vitamin A that can actually be beneficial for the immune system and can be beneficial for the skin. But here's the problem. The body can't metabolize all that high vitamin A at once, and it can't do it for a prolonged period of time, which means that it starts to build up in your body, namely your liver. And it literally can be toxic. So if you have peeling lips with a red rash around it, be careful that it may not be from vitamin A toxicity. If that's the case, you want to go on a lower vitamin A diet for probably between 6 and 12 weeks. I will talk about this more in the future, so stay tuned. Now, vitamin A can be taken in normally through food. Your red vegetables, your orange vegetables and fruits as well, your red peppers, other peppers as well, orange peppers, your sweet potatoes, etc. And that's usually totally fine. Carrots, no problem, okay? And also beta carotene from supplements, usually no problem. But when you start to add in the retinol-based forms, those can build up. Now, how much vitamin A can you get on a daily basis from nutritional supplements with it usually not being an issue? 5,000 to 10,000 a day, usually no problem. Usually no problem. Now, some people, though, are taking 25,000 to 50,000 a day to boost their immune system. If you are doing that, work directly under a qualified doctor or your healthcare practitioner, okay? Don't use the high dosages unless you're under direct supervision. 5 to 10,000 a day, not more, okay? So, and then also be careful of the more toxic forms that are actually being used in most skin-based products, okay? So hopefully that is helpful as well. Now, other causes for dry lips, cracked lips, discolored lips, burning lips, like any of these can also be from an allergy or an allergic reaction or food sensitivity. So that means the lips can get a little puffier, a little bit more red, a little bit more swollen. And this happens from eating a food that may have an immediate reaction, would be more of an IgA to IgE reaction. That's called immunoglobulin mediated reactions, right? So what happens here is you eat the food and within minutes or hours, all of a sudden you have this reaction and your lips and your face is itchy and your lips are a little swollen and they feel red and they're burning. Okay, you ate a food that you're sensitive to or an ingredient that you're sensitive to or a pesticide on the fruit such as strawberries that you're sensitive to. You may not be sensitive to strawberries, but you very well may be sensitive to the organic or conventional pesticides sprayed on those strawberries. All right, always keep that in mind. I learned this even with organic pesticides on strawberries because my youngest daughter is sensitive to strawberries, or so we thought. And we said, okay, it's not happening with organic, but it's happening with conventional. And then one time it happened, so we said, oh, it's the pesticide. Now, we try to never eat strawberries that are not organic, and here's why. They're part of the Dirty Dozen, right? And if you don't know what the Dirty Dozen is, just go to StephenCabral.com/podcast, type in Dirty Dozen. So here's the thing though. So we buy organic, okay? And now it happened a couple times with organic. We said, we don't get this. It's only happening sometimes. So we wash the strawberries. Lo and behold, there's no more reaction. All right? So I just want you to keep that in mind. It could be a food sensitivity. Now, believe it or not, the lips could be swollen the next day after eating something. This is more called what's called an IgG reaction. The way that you're able to figure these out is through a complete food sensitivity test. Again, you can find these labs over at equilibriumnutrition.com. You can find the supplements there as well. But also, if you're working with a really good functional medicine doctor locally or your integrative health practitioner, they can help you as well. So simply do what's best for you. All right, but these are important ones, so I want you to check that out. A delayed reaction really needs to be lab tested for because it could have been any one of the 3 meals or, believe it or not, 6 meals that you had over the course of 2 days. So I'd love people checking that out as well. Another one I want to share with you is actual sun damage. Now, there's a couple things I want to watch out for this. Again, if your lips get a little chapped, they get a little red, they get a little dry, you very well may have gotten too much sun. And your lips were maybe more potentially exposed or sensitive to it. Now, people's lips and skin can become very sensitive to the sun based on medications they're on. So always ask your doctor, is my skin more sensitive to burning based on the medication? And believe it or not, taking an herb such as St. John's wort makes you more photosensitive. That means more sensitive to light, namely the sun. But the other thing I want you to be careful. So again, in this particular scenario, you may want to wear a chapstick with a natural-based SPF in there, like an SPF 30 inside of that chapstick. That will help, right? Or zinc oxide. Now, what else I want to share with you is this. Is we have to be careful of the lips and sensitive-based areas, because if there is any type of purple spot or black spot growing on the lip and it was from sun damage, I do want you to have that checked by your PCP or dermatologist. I just want to make sure that it's not a melanoma and potentially a malignant or cancerous-based melanoma growing. Why this matters is that if you catch it early, we can take care of it. If it starts to spread, not a good thing, all right? So let's get this checked. Let's get safe sun. I still recommend sun, but safe sun. No burning, and hopefully that will help you as well. Okay, I want to share just maybe one more with you. Let's see if I had any left on my list. And I've actually gone through my full list, just making sure I hit them all. So the other that I would just share with you is making sure that you understand how important your overall gut function is to the skin and lips of your body. If your body starts to show drier skin, drier lips, if it starts to show any type of brown spots or anything like that on the skin, I want you to understand is that if we are building up a lot of inflammation in our body, namely from our digestive system and gut, it begins to show on the skin first. So that dry skin could be lower omega-3s, it could be dehydration, it could be lots of things, and I've chatted about that before. But our lips too are almost one of those dead giveaway is one of the first things that starts to falter, which is also why I do not want you to begin to mask those symptoms, right? So I want you to just not put lots of lubricants and oil and moisturizers on your lips to get rid of that dryness or to get rid of the cracking or to get rid of the redness. I don't want to use those cortisone creams. Here's why. I want to try to figure out what is going on. Is it vitamin-based? Is it gut-based? Is it fungal-based? Is it vitamin A toxicity? Is it medication? Is it dehydration? Because if it is, we're able to fix those at an underlying root cause-based level, where then the symptoms, which is the lip-based issues, can no longer be a factor. So hopefully this was helpful. Thank you so much for tuning into the show. I appreciate you. And as always, if this was helpful, please do feel free to share this show with anyone you believe it could serve. Ever wonder what the best sauna, blue blockers, sleep trackers, wake lights, salt lamps, or other health gadgets are? Or what about the top non-toxic mattresses, sheets, soaps, bath products, toothpaste, and cookware? Or would you like to know the cleanest choices for hemp parts, meal delivery services, supplements, and much more? I personally curated, researched, and now created a resource page of all of my top picks that continues to grow each week. These are the exact products I use in my own life, with my family, in my private practice, and they're the ones I trust. To find out all of my up-to-date recommendations and all the details, simply head on over to stephencabral.com/resources.